The Ideal Implant has an innovative design, which even includes its packaging. With other breast implants, to avoid contamination, the scrub tech or surgeon has to carefully lift the inner tray out of the outer tray. This can be an awkward maneuver, so we designed an innovation to make your life easier. We built a grip into our outer tray. Now the circulator can grip the outer tray securely with one hand, remove the Tyvek lid, and drop the inner tray onto the sterile field. Also, we put a label on the inner tray showing the implant size, serial number, and fill volumes for the inner and outer lumen. This is convenient to have during surgery. The Ideal Implant has two valves. The anterior valve fills the outer lumen. The posterior valve in the center of the patch fills the inner lumen. Two fill tubes are necessary, so you know which tube goes to which lumen. The one for the inner lumen is marked Pack, Big, Begin. After the implant is in place, begin with this tube and fill the inner lumen, which is the bigger volume and on the back of the implant. This tube goes into the posterior valve on the back. The other tube is unmarked and goes into the anterior valve. Then, squeeze the air out of the implant and hold it while the assistant connects a check valve to each fill tube. Use a syringe to aspirate the remaining air from each lumen. The baffle shells inside make it impossible to remove all the air, so don't waste time trying. The remaining air will be absorbed by the body in about 10 days, and there is no sloshing sound because of the baffle shells. To prepare the implant for insertion, fold it in a gull-wing fashion to cover and protect both fill tubes, so when it goes through the incision, the tubes are covered and will not be knocked out of the valves. The opening you need is relatively small compared to what you would need for a silicone gel implant. Once in place in the pocket, what the surgeon sees on the outside is the two fill tubes. The marking on the tube shows which one goes to the inner lumen. Begin with it. Fill to the specified volume only and pull the tube. The remaining tube goes to the outer lumen, which is the adjustable volume. The inner tray label shows the implant size and serial number. The inner lumen volume is set and not adjustable. Do not overfill. The outer lumen is adjustable within the range shown. The minimum is called high to indicate that this is sufficient, and the maximum is called 100%. Do not overfill. The range of total implant volume is shown. This total is made up of the volume of the empty implant shells, plus the volume of the inner lumen saline, plus the volume of outer lumen saline. These three volumes make up the total implant volume. Remember, do not try to remove all the air and do not overfill the implant. The geometry of the Ideal Implant is very different from other implants. So, when performing an implant exchange, consider the three-dimensional geometry of the existing capsule. Even if not contracted, the capsule around the old implant is fibrous and will not match the geometry of the Ideal Implant you are inserting. Therefore, when replacing an existing implant with an Ideal Implant, release the old capsule completely. Otherwise, that old fibrous capsule may distort the Ideal Implant edges and its contour to the chest wall.